natural childbirth, many of those methods are much less traumatizing to the child when you begin to look at the long-term results. For instance, it's not a coincidence that we began using a lot of drugs in childbirth in the 40s, and then we began a drug culture in the late 50s and early 60s.
Because of what happened then?
Because the children first experienced drugs at birth.
You don't think that people would ever use that as a cop-out, do you?
I don't know if it's a cop-out or not, but it certainly is a causative part of what people do. These very early childhood events make a tremendous impact.
And that's a problem with society, too.
Yes.
And nothing, you know, that we can really fault at the time.
No.
What do? You can't blame all the doctors of that time.
No, it was the very best thing that we knew to do at the time. Looking back on it, we perhaps would change it now. So there's a lot of doctors who are currently revising the amount of drugs they use, how they use drugs in birth. We're going to dimly lit delivery rooms as opposed to very brightly lit delivery rooms. They're raising the temperature in the delivery room because you have to understand the baby is going from a womb which is 98.6 degrees to a delivery room which in many hospitals is 70 degrees.
And they're even doing some water babies too.
Yes, and there's a lot of water birth going on now and so forth. The whole purpose of all this is to make the birth process easier on the child.